Welcome to SourcePoint's overview of Medicare supplements and Part D plans. We'll cover what each option is, how plans differ, and when to enroll. Let's get started. Medicare supplements, also called Medigap, are secondary plans that help pay some of the costs left after Medicare Parts A and B pay. People typically get this extra coverage in one of three ways: through a former employer or union plan, through Medicaid, or through a Medicare savings program for those with limited income and resources. Medigap is private insurance that works with original Medicare A and B. You enroll through an insurance company and pay a monthly premium to that company. In general, Medigap premiums can't be deducted from Social Security, so many people set up an electronic transfer from a checking or savings account. Medicare supplement plans are standardized, so each plan has the same benefits no matter which company sells it. What varies is the monthly premium. Companies also decide which plans to offer in each state, so availability can differ. Plans currently available include A, B, D, G, K, L, M, and N. Medigap plans don't use provider networks. If a provider accepts Medicare, you can generally see them, no referrals or prior authorizations needed. And you're covered anywhere in the US when you travel. Remember, Medigap only helps with costs for Medicare-approved services. If original Medicare doesn't cover a service, the supplement won't pay for it either. Your best time to enroll is during guaranteed issue, your Medigap open enrollment period. It lasts 6 months starting with your Medicare Part B effective date when you're 65 or older. You may also qualify under certain special situations. Special enrollment is available within 63 days after losing prior coverage through no fault of your own, such as an employer plan ending or a plan leaving the market. If you qualify for Medicare due to disability and are under 65, Medigap options can be very limited. In Ohio, affordable Medigap plans are generally not available until you turn 65. On this chart, plan names are located across the top row, and benefits are listed down the left column. Each box shows the percentage the supplement plan pays. For example, Plan G pays 100% for most covered costs, except it does not pay the Medicare Part B deductible. After you meet the Part B deductible, Medicare-approved services are typically covered at 100%. Now compare Plan G to Plan N. Plan N also doesn't cover the Part B deductible or Part B excess charges. Plan G generally has a higher premium because it provides more coverage. Typically, greater coverage results in a higher monthly premium. Part B excess charges are amounts above Medicare's approved rate, up to 15% in most states. Ohio is a no-balance billing state, so excess charges don't apply here. The 8 no-balance billing states are Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. If your plan includes foreign travel emergency coverage, it's typically 80% after a $250 deductible, up to a $50,000 lifetime maximum, for eligible emergencies during the first 60 days of a trip. Most people with Medicare should have Part D prescription drug coverage. The exception is when one has other credible drug coverage, such as through an employer plan or VA coverage. Part D plans are offered by private companies that contract with Medicare. Unlike Medigap, Part D premiums can be deducted from your Social Security benefit if you choose. You can get Part D coverage either as a standalone prescription drug plan or as part of a Medicare Advantage plan. Your initial Part D enrollment generally aligns with your initial Medicare enrollment. If you go without Part D and don't have credible drug coverage, you may pay a late enrollment penalty, which is about 1% for each month you delay. The penalty is based on the national average premium, which changes annually, and usually lasts as long as you have Part D. Part D open enrollment runs every year from October 15th through December 7th, with coverage starting January 1st. It's smart to review your plan annually. Plans, premiums, and formularies can change, and your medications can change too. A good starting point is the Plan Finder on Medicare.gov. When comparing prescription drug plans, think about the 3 C's: convenience, coverage, and cost. Most plans use pharmacy networks, saving money with preferred and network pharmacies. Many plans also offer 90-day mail-order prescriptions, often at lower cost. You can use both mail-order and local pharmacies for different medications. Ensure your medications are covered and listed on the plan's formulary to avoid full costs. Formularies change, so if a drug is removed, bring the formulary to your doctor and ask about covered alternatives or request an exception. Generics are usually cheaper than brand-name drugs when available. Medicare plans categorize drugs into tiers 1 to 7, with lower tiers generally costing less. Consider the total costs, premium, deductible, copays or coinsurance and your specific drugs. Then compare options on Medicare.gov. A higher premium doesn't always mean better coverage for you. The best way to choose is to run a personalized comparison on Medicare.gov. SourcePoint also offers plan comparison classes. Call for details. Part D deductibles and costs change annually, so review your plan each year. Some plans waive deductibles for certain generics. And depending on the tier, you might pay a flat copay, such as $5 or $10 per prescription, or a percentage, such as 25% or 50%. Lower tier drugs usually have copays, while higher tiers often have coinsurance. In 2025, the coverage gap, known as the donut hole, was replaced by an annual out-of-pocket cap for Part D drugs. This cap applies only to Part D prescriptions. Drugs administered by healthcare providers, like infusions or chemotherapy, are usually covered under Part B. The cap will likely be adjusted for inflation over time. Amounts paid toward your deductible now count toward the out-of-pocket maximum, but only for covered medications. Uncovered drugs don't apply. There's no extra enrollment for this adjustment. Your Part D carrier applies the cap automatically. A new out-of-pocket smoothing option, also called the Medicare Prescription Payment Plan, allows you to spread prescription costs throughout the year. While it doesn't lower total costs, it aids budgeting as plans can't charge fees or interest. You can set up a smoothing payment plan through your insurance carrier. You can enroll at any time, but enrolling earlier helps distribute payments more evenly. When choosing a Part D plan, keep these points in mind. Each plan has a different cost structure. Late enrollees may incur a 1% penalty for each month of delayed enrollment. Those with limited income and resources may qualify for Extra Help, which is a subsidy program through the Social Security Administration. We will cover this program more in the last video in this series. Part D plans can sometimes substitute a newly available generic for a brand name drug on the same or lower cost tier, often without advance notice. Plans that use general notice must provide a 30-day supply of the brand name drug if you request it. If needed, you can also ask the plan for a formulary exception. That wraps up our overview of Medicare supplements and Part D plans. We hope this helped answer your questions. If you'd like more support, consider registering for an in-person class at SourcePoint. For dates and times, please check the insurance section of our website.